I'm Dr. Anthony Kaveh, a Stanford and Harvard-trained anesthesiologist and integrative medicine specialist. And viewers all over social media, my patients, loved ones, and even other doctors often ask me a very important question, and it comes up all the time. And that's how to find the right doctor. So here are easy steps for you to find the right doctor for yourself or for loved ones who are also searching for a doctor. And it's really important to recognize that this does not use Yelp reviews. It uses questions that you were going to ask yourself. It's a very easy guide, and questions that you need to ask the doctor or those who have been treated by the doctor that you're considering. And it involves questions that surround semi-controversial conditions like ADHD. It's not controversial that it exists, but treatment around it is potentially controversial. Migraines, depression, heart disease, etc. And this all starts with what Sir William Osler said like 100 years ago. Sir William Osler, by the way, was the father of Western medicine. And he said, it is much more important to know the patient who has the disease than the disease that the patient has. That is the foundation for how Western medicine should be practiced, and quite frankly, how all around the world medicine has been practiced up until very recently in the Western biomedical model. With that out there, the first question you need to ask is actually not of your doctor, it's of yourself. What are you seeking? And this depends on the person that you are and your particular circumstances, this point in time, the support that you have around you from loved ones, etc., and also financial resources to an extent. There's two broad categories that patients will fall into. Of course, there are more, but the two main ones are, do you need a quick solution now? We call this in medicine the cheap back door. It's not necessarily bad when used correctly, but that's in contrast to the other fork, which is the root cause. Do you want a root cause? Do you want to figure out what is going on with your body and get rid of it from the root? Or do you need something now? Powerful examples that come to me before surgery or for my ketamine infusion clinic. The classic example is a single mother, limited income, suffering from debilitating chronic conditions, whether it's mental health conditions, cardiovascular, diabetes, etc. And they may not have loved ones around who can help take care of the kids. They may not have a job that is steady, that does not require them to work all sorts of odd hours. That individual, of course, is going to want to address the root cause of their suffering. But right now, maybe they need something that is going to help them not get sicker. And I respect that at the right time, at the right place. Alexis, thank you so much for that super thanks. So kind of you. And yes, we'll get Karma and Mochi more treats. Another powerful example is if you're coming to the emergency room or an urgent care clinic or even to your primary care doctor with chest pain and there's concern for a heart attack, it's not appropriate to say, well, what was the root cause? Did you have a cheeseburger last week? Is that why? No, you need to figure out exactly what's going on now. I call it the cheap back door, not because it's bad, but if you don't have the right resources, whether it's time, money, stability, etc., you need to do what's right for you with the right currency that you have available. It's not about being mean. It's about recognizing that life isn't perfect. So if you need a quick fix now, you need to be honest with yourself. If you want to address the root cause, you need to be honest with yourself. In my practice in the Bay Area, most patients, about 70%, fall in the category of, I want to figure out the root cause. It tends to be more common in older individuals that have already experienced life and they know the side effects of pills and pill mill-like approaches, and they don't want more medications. They know that the side effects are going to take them down. They know that they want to address why they are sick in the first place. There's exceptions, but that's step one. You need to know for yourself, which of these two broad categories are you in? The next question is what you ask your doctor. And these are questions that will flush out this doctor's approach to treating patients. And this is where these, what I call semi-controversial treatments come out. Not because the diseases or the conditions are controversial, but there is so much variety in how doctors treat them. And they involve pretty much every organ in the body. We start with the most apparent ones, which are psychiatric or psychological conditions, like ADHD, for example. You ask your doctor or someone who has been treated by that doctor, how would you treat ADHD? What's your approach? And right away, you're going to find that some doctors, I'm not saying they're good or bad, but they are very quick to go to stimulants, methylphenidate, etc. What we call Ritalin, depending on where you are in the world. And there's a time and a place for that. And then there's some physicians that ask, well, what about your diet? What about a past history of traumas, adverse childhood experiences, your depression, your current stressors, etc.? You see how there's an immediate divide. How about depression and anxiety? There are some that are going to be more want to go to SSRIs or SNRIs or TCAs, and that's perfectly fine in the right patient at the right time. And then there's some physicians who are going to say, well, what are the contributing factors for the cognitive rigidity, perhaps? What do you feel stuck in? Has somebody died recently? Lost of a job? How are you sleeping? What are your dreams like? There's so many questions that go into this. Right away, you will know, is this doctor somebody who is treating me the way that I believe a person should be treated in my position? Not, is this how a doctor should be treating patients? Because patients are different, they have different needs. But how is it that you want to be treated? These disease processes and their treatment show what kind of doctor you are potentially putting your life into their hands. Migraines are another one because triptans are very easy to prescribe and they can be effective at the right time, at right place. But there's also a pool of doctors that will say, well, what's the food diary like? How is the depression? How is the anxiety? How are the muscle tensions going all around your trapezius, etc.? There's many questions that go into addressing why the migraines are there, in addition to abortive medications or instead of abortive medications. How about asthma? This is a very common one. There are many, many doctors who will go quickly to the albuterol inhalers or the inhaled corticosteroids, and that's fine in the right time, right place. But what about what triggers it in your experience? What is, for example, was there an adverse childhood experience that you first remember, or some experience maybe in later adolescence that you remember really feeling tight in your lungs with? Environmental exposures, mold, etc. What kind of fix are you looking for? Is this doctor addressing this question the way that you want this to be treated? Just like Sir William Osler said. Candace Strike, thank you for that kind super thanks. I appreciate it. So more disease processes in the heart. So if someone has high blood pressure, you can easily give beta blockers. Is the doctor discussing the risks and benefits of beta blockers, potentially contributing to depression, worse metabolism, fatigue, etc.? Beta blockers can be life-saving. I'm not against them, but at the right time, right place. Or are they going into diet, lifestyle, loneliness, social support, mental health? Because we know how much your psychiatric and psychological state affects your blood pressure. We know how pets can be so powerful in reducing. Are they talking about pets? Is this the type of response that you want to hear from the doctor that's healing you? These are specific targeted chronic conditions. That's the whole point of these questions that you're going to ask your doctor. And we're going to talk about allergies as well in just a moment, but I do want to just thank everyone who is giving the super thanks here in our live chat, giving all this positive, encouraging talk to others. Do please hit that like button if you appreciate me coming on and sharing this with you. It really means a lot. Your support helps me do this more often so that I don't need to peddle ads or do product placement, because I want to give you information so that you can advocate for yourself in our broken healthcare system. And Patty Hoffman, thank you so much for that super thanks. And the treats for Karma and Mochi. Mochi is actually by my feet. If she gets closer, she'll make a cameo as well. Now, allergies and frequent URIs. When patients come to me with allergies, it's so easy and tempting to go do allergy shots at the allergist. I'm not saying that they're bad, but they are controversial, and it might not address why are the allergies there in the first place. So one class of doctor will go for the allergy shots, the cetirizine, Zyrtec, etc. Another class of doctors will be asking questions about why are the allergies there, as in what past trigger? Was it a diet thing? Was it an environmental thing? Once again, potentially mold. Was it a mental health state? We know that allergic type of reactions or body responses, anything from asthma to body rashes, etc., have a very, very strong psychological component to them. And some healers might not appreciate that and might not take you down that rabbit hole. So this is how you can quickly figure out, is this doctor giving me the response I want? Tara Kersey, thank you for that super thanks as well. Frequent URIs, same thing. Is it just giving out zinc? Which, hey, I also like zinc and I take zinc personally myself, but are they addressing that loneliness can increase your risk of contracting the common cold? Mental and physical stress can increase your chances and increase the severity. Are these being brought up, or is it just pushing for wear a mask, wear gloves, don't touch your face? Of course, those are important in the right patient at the right time, but we have to address the root cause. Your body weight, your presence or absence of diabetes, etc. And then we'll end with chronic pain, because this is really a huge fork in the road. Are we talking about just pushing tramadol, pushing gabapentin, pushing you name it, baclofen, muscle relaxers, etc.? Of course, there's a time and a place for those. But are we also addressing how physical pain and psychological pain are so tightly connected that you can rarely treat physical pain without treating psychological pain? And you can't treat psychological pain without treating physical pain. Is that the response that you want to hear from your doctor who you're trusting your life to? So it really comes down to human being versus human doing. Is this somebody who's treating you like a person, the person that you want to be treated, human being, or is it human doing, like a bag of chemicals or a meat bag and pushing pills? I don't mean to say that's the wrong way, but it's different, and there's a time and a place. And you really want to trust your doctor to know when is the right time, who is the right patient to use either approach for. And all of this, of course, is in addition to the foundation of having an empathetic doctor, a compassionate doctor, one who graduated from medical school, is board certified, etc. Those are all things that in this day and age we can relatively quickly determine from searching online or just from going to an established, well-respected hospital setting or clinic. So of course, that's the baseline. This is what's going to this specific level for what's right for you. In a different video, I'm going to talk about how to use Yelp reviews helpfully or be able to make the most of them versus knowing when to ignore them. And also whether you should go for young doctors or old doctors. You have incredible power over your health, probably more than you've ever been told. I hope that you always remember that. Please leave comments and fill out the polls for ideas for other live streams.